Thank you very much. Good afternoon, everybody. Welcome to the White House. We're so pleased to see you. This is an incredibly important time. We're in Suicide Prevention Month, and we're here to highlight the work being done all across the federal government to promote mental health and to address the need to prevent suicide. As you know, as I hope you know, from our activities over the last several years, these issues are a priority for the President, for the Vice President, and for all of us who work at the White House and across the administration. As the President said at our National Conference on Mental Health at the White House last year, it's critical that we make sure that people with mental health conditions aren't suffering in silence, that they know they're not alone, that they know that help is available, and that we do everything we can to make sure that help is available. That message is all the more important when we're talking about suicide prevention. Many of you work with the National Action Alliance for Suicide Prevention, which helped the Surgeon General produce the 2012 National Strategy for Suicide Prevention. That report reminds us that suicide is not a veteran's issue or a young person's issue or a male issue. It's an issue that impacts all sectors of our society and every corner of our country, and we need to be working together to do everything we can to prevent it. Today, we bring together in one room not only leading advocates for mental health prevention and treatment, but representatives of the veterans and service member community who fight every day for the needs of our warriors. Amen to that. Thank you. And we bring you together with government leaders from across both the civilian and military sides of our government because we know that we need to work together to confront this public health challenge. We all have a stake in the outcome. Mental health is an important priority for this administration, and we're pleased that with your help, we proposed and secured new funding for mental health this year. So it gives me great pleasure to announce that today we're making more than $99 million in mental health awards to communities across the country as part of the President and Vice President's Now is the Time initiative. This new funding will be awarded to schools and communities across the country to train new mental health providers, help teachers and others who work with youth in schools and communities to recognize and respond to signs of mental illness and connect those in need to help, and improve access to treatment and support services for youth who either have or are at risk of developing a serious mental health condition. These new investments build on our work to expand access to mental health care, including the $50 million in Affordable Care Act funding that we announced in December to help community health centers provide more mental health services. They also complement the work we've done through the Affordable Care Act and the Mental Health Parity Act to expand mental health and substance abuse benefits and parity protections for 60 million Americans. Just last month, the President announced 19 new executive actions to help improve mental health care for veterans, service members, and their families. These new actions build on his 2012 executive order, and as a result, VA increased its mental health staffing, expanded the capacity of the Veterans Crisis Line, and enhanced its partnerships with community mental health providers. DoD, VA, and the National Institutes of Health jointly developed the National Research Action Plan to better coordinate federal research efforts on these issues. We have a lot of work to do, but I know that our colleagues from VA and DoD will have the opportunity to talk more today about everything that we've got ahead of us and everything that we're doing to implement the President's new executive actions. And that includes expanding suicide prevention training, improving the transition from DoD to VA for service members with mental health conditions, increasing the ways that we're using peer-to-peer support to let veterans help veterans. So I'm very hopeful that you'll get a sense today of the scope of our efforts all across the federal government to make sure that people in need get help. We look forward to the many contributions you're going to be making to that work because it's tremendously, tremendously important. But most of all, I hope you leave today's session with a sense that not only that this is an urgent priority, if it weren't that you wouldn't be here, but also with a sense of hope that the continued commitment of this administration in partnership with all of you is going to advance this important work. So thank you very much for being here, for the work that you do every day, but especially for the work that we'll be doing together. Thank you all very much.